We're now turning to our expert interview, and joining me on the line is Dr. Alice Tan, internist at MizMedi Women's Hospital. Good morning, Dr. Tan.
Good morning.
It's great to speak to you once again, despite the circumstances. I guess this latest outbreak had been feared, but also somewhat expected. I know that authorities were warning us about a second wave of infections. We were probably thinking maybe in the fall sometime, but the warning signs were up because of the golden holiday. From a healthcare professional's perspective, did this outbreak sort of take you off guard, or were you expecting something like this to happen?
I think we were expecting something like this because even though we had several days where there were 0 new cases from the community, if we looked at the total number of cases over the last 2 weeks, there were still 8 or 9 cases with no epidemiological link. In other words, These are cases that indicate spread in the community. And because we know that so many COVID-19 patients have no symptoms, it was worrisome. It was worrisome, and with the loosening of social distancing measures, with the golden holiday, with people just being tired of being isolated and very eager to be outside and socialize again. There were wedding parties. It's so many social events going on. It was almost inevitable that we would see, I think, another cluster pop up, but we didn't realize that specifically that this was going to be the kind of cluster that we would see.
Right. As you mentioned, people were getting tired of social distancing, and the great weather kind of, I think, prompted more people to want to go out and enjoy this easing of social distancing as well. But we were sort of hailed by many countries and media outlets around the world as being very successful in controlling this with very aggressive testing, tracing, and isolating, along with China and Germany, of course. But these 3 countries, including Korea, we lifted some of those stricter measures, and then we did see a spike in infections. And the WHO warned that although China, Germany and Korea have the sort of necessary system in place now, any other country that thinks of maybe relaxing these rules, they need to be better prepared. Do you agree with the WHO that Korea was prepared to lift these restrictions, or do you think we maybe acted too soon?
Well, so there are 3 pillars of readiness that need to be established before regions can reopen in the midst of COVID-19. So first, the medical system needs to be ready to absorb and take care of the moderate and severely ill patients who are hospitalized. And we were ready in that respect. And this relates to bed availability, staffing, equipment, supplies, and we were ready. Second, the public health system needs to be ready to detect, test, and isolate infected patients, and then track and trace all suspected cases and their contacts. And we have a world-class system in place. So we were ready for this in this regard as well. Lastly, the public needs to be fully engaged and ready to comply with the infectious disease prevention measures that are going to allow our country to function while COVID-19 is still in our midst. And I think that we overestimated this last pillar. There may be individuals or sectors of society who are either unaware of or unwilling to follow the guidelines for infectious disease prevention in everyday life. And perhaps in this respect, we were not ready to fully ease our social distancing measures because we didn't assess the readiness of the public.
Right. But it is a relief to hear that our healthcare and our other sort of infrastructure is ready and prepared for a second wave. As you mentioned, the public's participation and full cooperation is key, and it is that 3rd pillar. With this latest outbreak in Itaewon, we do know that many or the majority of the patients were in their 20s and then followed by the 30s. And the young people, we have been talking about them over the whole pandemic, and of course, even the WHO issued a warning directly to the young people saying you are not impervious to the infection. And although there is no fatalities linked to the youngest people, especially here in Korea, they are not immune to the side effects or the dangers of COVID-19, right? If you'd like to take a moment to maybe just send out a message that to young people who still may think, oh, it's maybe just a bad flu, I'll get over it, it's not a big deal.
Right. So we've been fortunate, as you mentioned, in Korea to have very few fatalities in people less than 40 years old. There have been a few in people who are in their 30s, but for the most part, the vast majority of young people have been asymptomatic or had only mild symptoms. However, we're looking at society as a whole, right? One of the cases that turned out positive from the Itaewon Club outbreak is the grandmother of one young person who went to the club. And
84 years old. Mm-hmm.
Right. She's definitely high risk. She may not survive, and so it's about protecting, your family, your loved ones. You may be fine. The other thing that we need to perhaps consider is, there may be negative consequences to people coming forward to get tested. If they turn out to be positive, they're going to have to be isolated for 2 to 3 weeks. Are they going to lose their jobs? What's going to happen in terms of absenteeism? I think the government needs to think about this and put guarantees in place so that they are not penalized for doing the right thing. But we are calling on sort of the altruistic, motivations of young people to come forward to get tested if there is any suspicion that they may have been exposed.
Right. Aside from the risks that you've mentioned, if they are found to have been infected or even those 2 weeks of quarantine having an impact on potentially their job situation, even the health risk, as you mentioned, here in Korea, we've had, I believe, no fatalities or very few in the younger generation. But around the world, there have been cases of young people getting very sick, and we still don't know the sort of the lingering effects of someone who has actually sort of survived COVID-19, right? We're seeing reports of possible maybe impacts on their hearts as well. Can you tell us more about that?
Right. So this is a brand new disease, so we have no idea if there are going to be any lasting long-term effects. People get pneumonia, we know, but then, is there residual fibrosis left in the lungs? We don't know. Are there going to be changes in their immune system because of this? We don't know. In terms of the heart consequences, a lot of the cases that were reported out of China early on, the fatalities showed elevated cardiac markers. In other words, there was evidence of damage to the heart muscle because of COVID-19. And then young people who are otherwise healthy, they seem to be more susceptible to something called cytokine storm.
Right.
In other words, they have very robust immune systems that kind of go into overdrive because of COVID-19, and this actually leads to more damage in the body. The body is kind of turning on itself because of COVID-19 acting as a trigger. And so, we've been lucky so far in Korea, but that does not mean that 100% everyone, who is young is going to come out of COVID-19 unscathed. And so, people still need to be careful.
As you mentioned, cytokine storm is when sort of your immune system goes haywire and kind of turns on you. But we have heard throughout that maintaining a healthy immune system will also help us protect us against infections and also if we do get sick with the COVID-19 as well. Vitamin D seems to be one of those new sort of things that are coming up in media. Researchers have discovered a strong correlation between a severe vitamin D deficiency and mortality rates as well. So I want to ask you, Dr. Tan, what would your advice be on taking supplements like vitamin D? Before a couple of weeks ago, I believe there were reports that vitamin C megadoses might be helpful as well. Would you recommend everyone take their vitamin C's and D's as a way to sort of boost our natural protection against the virus?
Well, at this point, the association between vitamin D levels and death related to COVID-19, I think at this point it's nothing more than a suggestion. It's a very loose association. Are vitamin D and C levels important to maintaining good health? Yes, absolutely. We already knew that. Are they proven to prevent infection or death due to COVID-19? I see no hard scientific evidence that proves this at this time. So do I recommend vitamin, D and C as a, preventative measure? No. I mean, is it good for overall health? Yes. As we go into winter, is there a lot of vitamin D deficiency? Yes. But, I have not seen any clinical trials looking into vitamin D as a therapeutic agent in Korea or elsewhere in the world. And if anything, our country's statistics would argue against the claim that vitamin D deficiency leads to higher death rates because we have one of the lowest death rates for COVID-19 in the world, yet our prevalence rates for vitamin deficiency in our population are actually quite high. Nearly 50% of Korean men and about 65% of Korean women have vitamin D deficiency. So, it's hard to make links without actually having done the clinical trials, and there are none enrolled right now. There are no clinical trials looking specifically into this yet.
Dr. Tan, my last question to you. Despite this second outbreak, we are maintaining those sort of eased social distancing measures for now, and students are expected to go back to offline classes starting next week if we don't have another delay, of course. And authorities have not actually changed any of their guidelines for the general public. Do you think that is appropriate? I mean, more people will probably be heading outside to enjoy the good weather, maybe, top up their vitamin D as well. Are clubs and these sort of like not ventilated, these big sort of where large crowds will tend to mass, do they just need to be closed down temporarily, or do you think the current measures are sufficient? And we just have to get used to these kind of secondary or third clusters happening now and again.
Yeah, well, I think that this outbreak is a lesson to the public of how important our infectious disease prevention measures in everyday life are. The financial impact on the owners of the businesses that fail to follow the guidelines, and the public health impact, and they're huge. So as we continue the epidemiological investigations into this outbreak, I think, we need to assess the situation closely and decide, what else needs to be done. But we need to be pragmatic. There are certain businesses that realistically are not compatible with physical distancing and the wearing of masks. And I think that these types of businesses, such as, nightlife venues, they do need to be evaluated and assessed. I know a lot of cities and provinces around Korea have, now mandated that they close. But there are other similar, businesses and organizations that I think would benefit from on-site evaluations, sort of preemptive on-site evaluations, and perhaps on-site training of the leaders of those organizations, sort of as a safety check, kind of like we do safety checks for buildings for earthquake, prevention, things, safety. Just like we make sure buildings have smoke detectors for fire safety. I mean, I think infectious disease safety measures now need to be part of the new normal and enforced, and we need to help the public.
The authorities have laid those out, but I guess this will serve as a wake-up call for us to really realize them and practice them stringently, as well as the general public, of course. Dr. Tan, thank you so much for joining us and giving us your expert advice.
Thank you for having me.
Thank you again, and hope you stay safe.